Is a bedtime snack necessary for gestational diabetes?
Gestational diabetes is high blood sugar first detected in pregnancy. A bedtime snack is not required for everyone. It's useful if fasting morning glucose is high, you use insulin, or there's a long gap between dinner and breakfast. Choose a small balanced snack, complex carbohydrate plus protein or healthy fat. For example, whole grain toast with peanut butter, or Greek yogurt with nuts. Track glucose and work with your care team to decide.
If you enjoyed this video, please subscribe.